this series of workshops. So we really are kind of trying to be at this part of our faculty development with related to competence by design. That idea that hopefully you've all moved kind of, well, maybe some of you are still thinking why we're doing it, but we're at least past the how we're doing it, and now we're trying to get to how do we do it better. And so this workshop and the next two that we've developed in this series are really trying to think about what we're doing and how we can maybe do it better. As I've met with the various programs over the last year, because I think I've met with almost all of you, there's a few comments that we hear a lot. And one of them is about the Competence Committee and the amount of time that it takes, and specifically the amount of time it takes for reviewers, or if that's been delegated to the PA, the amount of time it gets them to get ready for a meeting. And that kind of translates into worry about retention and recruitment and things like that. So that's really one of the reasons that I asked Jim to come and talk to us today. The other common one is that faculty aren't completing EPAs, so that'll be a future workshop. We thought we would do that one after accreditation is over, because we thought that one might be of relevance to the program directors. So there's 3 workshops that we have planned right now. There's this one. There's one in April about individualized learning plans, and that's really trying to address both sides of things. Both the learner that's not progressing the way you hoped, as well as maybe you identify some learners that are actually moving ahead faster than you thought and are accelerated, and what you need to do about that. And the other thing we heard from Competence Committee chairs is sometimes just the managing the group dynamics. The person that's the overtalker, the person that kind of shuts everybody down, or the reviewer that's really not contributing the way that you're hoping they were. So hopefully that series is helpful to you. So the objectives for today are to have a look at the visual summaries. We have found that some folks don't know that they're there, or don't know the best way to use those. So we got some experts in to help you with that. And then hopefully you will share what you found that really makes your competence committee tick and tick well. And we can develop a little bit of a community of practice around this. So with that, I'm going to introduce Jim Watterson, who's the Vice Chair of Education for the Department of Surgery, and Christine Seabrook, who is the lead administrator of a team of, I want to say 7 PAs, 10. Maybe more, 10. So they've had lots of time training their various competence committees, and they get to see lots of different types of functioning of competence committees. And hopefully they can teach us something. Thanks, Jim.
Thanks, Elentra. Okay, let me see if I can get out of this here. Okay, great. And again, everyone can hear me okay online? Thumbs up. Awesome. Thank you, Elentra and Janine, for inviting us. So Chrissy and I have been sort of 2 peas in a pod for the last, probably about 6 years or so. In my role as a Vice Chair of Education, we were sort of we were sort of facing the fact that CBD was being launched. My sort of time in CBD goes back to my time as program director. From 2010 to 2017, part of one of the constructors for CBD for urology, and we were one of the first surgical specialties to get launched. So when I took over as vice chair of education for the Department of Surgery, we really sort of had this vision that we were going to standardize CBD, the implementation, as well as all the workflows and processes using urology as a pilot program, for which again I've chaired the competency committee since we launched in 2018. Again, a little bit of disclosures there. I do sit on one of the Royal College National Advisory Committee as well, that helps to sort of feed back improvements to CBD as well. So that's who I am and why I am here. So again, in the chat at some point, I'd like to hear who you people are, what you hope to learn today, and what the current CBD challenges are for your CC. And maybe we'll just sort of fire those into the chat, and we'll certainly take questions as they come. as Yolanta said, too often we're siloed. And I think that part of the importance of the workshop today is to really sort of break down those walls, bring us together, share ideas, see where the current tensions are, as they say, and see if there's anything we can help. So objectives were outlined by Elentra. I've tacked on, if we have time, a little bit of the faculty reporting feature in Elentra, which I think is part of the whole competency committee CQI aspect. There's some nice features there with respect to faculty development as well as program development. So if we have time, we'll delve into that as well. So thinking back to when we were tasked with starting competency committees, again, these questions: how do you run a competency committee? The Royal College said you're going to run a competency committee, but there wasn't really a whole lot of practical experience. So we were sort of building this from the ground up. It was always sort of our vision to have practical solutions for our competency committees. Again, just an overview of resident assessment. I'm going to assume that everyone has this sort of basic knowledge and the flow through of how we review residents through CBD. Some of the challenges that we faced in the Department of Surgery, again, workflows were not really predetermined, no practical Royal College guidance, no practical PGME experience early on, huge deficiencies in the Elentra electronic platform initially, poor visualization dashboards. So CBD and competency committees really ended up being almost an accounting process where we were sort of just counting EPA assessments. And again, because we were siloed, working in different sort of environments, different departments, there were different, obviously, workflows that were developed. And again, harkening back to what Yolanta says, I caution using the term best practices. This is one practice that we've developed in the Department of Surgery, and there's definitely more than one way to skin a cat, as they say. So over the last number of years, Christine, myself, and our team, along with the program directors and competency committee chairs within the Department of Surgery, really looking at ways to improve. So standardized workflows. One of the benefits of our Office of Education, which administers 10 different programs for the Department of Surgery, we again developed this sort of standardized approach that can be then applied to every program that's being onboarded. Also allows for some redundancy. So if a program administrator is sick or has to step away, we can drop someone in again seamlessly. So there were definitely some benefits. Efficiencies were a big part of what we were trying to do and trying to improve upon. And as the dashboards began to improve, so did our efficiencies as well. Again, general overview of CC meetings. So there's a pre-meeting where you set your agenda, assign your primary reviewers. The primary reviewer's job is obviously to review the resident file, compile the data, and then bring that data to the meeting where it's presented by the primary reviewer. The committee obviously discusses the data presented and the evidence presented. And then there's a recommendation that's sort of decided upon by the competency committee members. Whether that's, again, by most times it's by consensus. There's a discussion and there's a consensus. And then post-meeting, of course, then there are activities that are required post-meeting. Again, ratification by the RPC, obviously communication piece with the residents, any independent learning plans that need to be developed or assessments and so forth are developed by the RPC and supported by the CC. So that's sort of an overview of what a general competency committee. So pre-meeting, meeting, and post-meeting. Any questions to that point? We're okay? Okay. No questions in the chat? We're getting there. We're getting there. Okay. So there are a bunch of QR codes. We've developed some video walkthroughs that are housed on our YouTube channel for the Office of Education. So a lot of these workflows are in video format where I speak. I'll walk you through where to push on Elentra, et cetera, et cetera, et cetera. So QR code there can take you through our CC workflow. What I'm going to present is actual urology. This is our process in urology. So every competency committee will have obviously their schedule, and you'll have to sit there and decide where and when do you want to review your residents, at what levels, how often, and that'll be dependent upon, I think, how many residents you have in your program. Again, the Royal College stipulates that they have to be reviewed twice a year at minimum. So again, this is our calendar of resident scheduling and review at CC meetings. And of course, there are ad hoc residents that are in difficulties. You'll add them on to the meetings and so forth. So with that in mind, again, thinking about the pre-meeting, meeting, and post-meeting, this is how we run urology. So there are various roles. There's the CC chair, which again, I fulfill that role. There's a program administrator that helps to support the administrative side, and then the primary reviewers. So the pre-meeting, my job is really to sort of, again, set the agenda, look at which residents need to be assessed. We've developed a bunch of these different, now this may not work, one second. And yeah, this one will work. So, and these are all stuff that we can share with you. So we standardized what our agenda will be like in terms of, a standardized agenda, standing items, including, any potential there for discussion about how Elentra is working, or 145, or other ePortfolio, some aspects about, your processes and workflow, faculty development. And then there's a place there where you can actually slot in your primary reviewers and which residents. So it's a standardized template. So that is sent out to all of the to the reviewers. We do have let's see if this will work. So again, this just sort of shows you what it looks like in the filled-in format. And that's what's mailed out as part of our agenda. Okay, so the next step is the program administrator basically will make an assignment. And again, we'll give links to our SharePoint folder where all of the resident data is kept. So all the secondary metrics, so the non-EPA based data that our reviewers will look at. So again, it's a standardized email format that is sent out to the basic reviewers. And again, this is urology, this is general surgery, you name it. But basically, each reviewer is introduced to who they are assigned to. And again, there are accesses, links to Elentra. Sometimes our reviewers, we hope, know where to find Elentra, but we want to assume that we're supporting every level of Elentra worthiness, I guess. So there are links to Elentra with, again, some little pointers where we found little advice on where to find such areas to review. There are also links to the specific residents. So again, these will be direct links into our SharePoint. So making it as simple as pie for your reviewers. So they don't have to go looking anywhere. It's clicking the link that'll drop them right into SharePoint, where they'll have access to their 145 data, their Pulse 360, their ITARs, etc. All the non-EPA data. Okay. And then the reviewers are sent basically a fillable template. And this is what we are using for our competency committee primary review report. And the report basically follows the process. So let me see if I can find my report here. That says agenda. Maybe it's this one here. Perfect. And I think it's opened. No, that one's not going to work. Apologies. Sorry. Nope. Shoot. Maybe it will work. I open here. Okay, perfect. So, so this is our standardized form that we set out to make, again, to make it as easy as pie for the reviewers to follow along. And the form was really designed to follow the process in Elentra, which we're going to get into. And so again, thinking about your comps committee meeting, we have our pre-meeting. So the pre-meeting, basically the program administrator fills out the details and the demographics of who's going to be reviewed. So the name of training, the reviewer, when they were last reviewed, the reporting period, training level, CBD stages. The program administrator also brings forward any actions and recommendations from last CC report. So it's in there for this primary reviewer to look at, and any rotations completed since the last meeting. That is then again sent to the primary reviewer. This is what the primary reviewer will then open up. And as we can see, the form has been set up such that it will follow along in Elentra. We're going to get into Elentra and we're going to follow that process as per the form. But again, little cues have been put on the form. So we're going to go into a global EPA review first. You're going to sign into Elentra. You're going to hit the tab, assessment and evaluation tab in the top right corner, then go to My Learners tab, then go to visual summary. So it is literally a step by step by step instruction on how to get through Elentra. And part of this is also thinking about, you're going to have turnover in your competency committees. You're going to be bringing in new members that are going to have to learn that process. So if we can make it as easy as possible to bring on new competency committee members, it'll be less daunting for them as well. And I think you're going to find that your recruitment may not be as challenging. So when we look at Elantra, we were looking at a global EPA review. Again, sort of a 30,000-foot view. Is the resident engaged in the CBD process? Are they actually getting EPAs, okay, or having assessments done? And we've set standards in the Department of Surgery. We want to try to see greater than 3 EPAs per week, greater than 12 per block. There has to be enough data there when the resident comes up for a review for us to actually state anything. Again, normative assessments. So again, I'm going to show you all this in Elantra, but there is normative type of graphs that allow you to look at your resident that you're assessing and compare them to residents in their similar stage to see whether or not they were an extreme outlier. There's obviously going to be some variability. Some are really keen, maybe some are not as keen, but you're just really looking for the low outliers. We will have the specific EPA assessment review. So for the form, every EPA is basically listed in the form. And we go through that. Now, again, if someone's already through the stage of transition to discipline or foundations, then obviously we skim through this. But we will then use this form in conjunction with our review in Elantra, pulling out the specific EPA data, looking at the specific EPAs. Have they started to actually, pursue any assessments in a particular EPA? Is that EPA stage appropriate or level appropriate? We know that some of our surgical residents, they won't actually tackle some of these core EPAs until their 5th year. So we start to look at that and we start to assess, and we're going to dive into some of the deeper things within Elantra. The form also then allows for the secondary metrics. So again, allows the reviewer to look at the non-EPA data, which we think is very, very important. There's no CanMed specific data in EPAs and milestones. It is buried. And we think that that's important to still have a bit of a more holistic view of your resident. So we still maintain ITARs within the Department of Surgery and Urology specifically for that reason, broken out with specific CanMeds roles. Examinations, if you have them, surgical logbook review for our surgical programs, Pulse 360. And then at the end, what we ask our primary reviewers in order to ensure that there's efficiency of process. The primary reviewer, is the best one at that point in time to identify the strengths upon the review, identify any areas of improvement, and we ask that our reviewer makes an initial recommendation. And that's part of what they're going to be presenting at the competency committee. Is the learner on trajectory or off trajectory? And if they're off trajectory, why are they off trajectory? Okay, and this can all be filled out by the primary reviewer. The goal is to make your competency committee as efficient as possible. Right? We can't spend hours and hours and hours doing these committees. So there is a bit of a lift there by the primary reviewer. Absolutely. It probably takes me a good 30 to 45 minutes per resident that I have to review prior to a competency committee. But the hope is that translates into maybe a 10 or 15-minute discussion for the resident. Then a status recommendation is made, progressing as expected, not progressing. And then learner actions. Again, these are all rural college learner actions, some of which require notification of PGME. Again, we can put forward any potential action plans for improvement or ILPs, but ultimately that is the RPCs. If a resident requires an independent learning assessment or remediation, that's the role of the RPC. And then again, the last thing is, what is the plan to inform the resident? Upload it to CC report to the Elentra. Sometimes, again, it's just an email. Most times it's just an email. You're doing a great job. Here's your report. It's being uploaded. Carry on. Sometimes it requires a little bit of a little chat, coffee chat with the program director. Most times it's because of low EPA assessments. So really trying to hammer home that point of they have to do their EPAs. So that's our report. I'm going to now dive into Elentra. Any questions so far in the chat? We're good so far? What's that?
Are the primary reviewers all members of the competence?
Yes. Yeah. So comps committee has a comps committee chair that cannot be the PD. We have our PD, and then we have, for us in urology, we have 4 other reviewers. And we have a total of about 20 residents in our program. Okay, for time, seem to be going along. Okay.
Before you go
Yeah.
to the Elentra stuff, just in terms of if you think about a small super program,
Yeah.
with sort of the same basis term table with the RPC, CC, to what extent does that workflow change, or does it need to? Right, you've got a small number of residents, a small number of viewers.
Yeah.
Recency chair. So what are your thoughts on that? Because I'm projecting to when we go live in 2025. We've got a CC right now, but I'm just looking at it.
Yeah. So I'm not sure if the people in the chat heard that, but Dr. Villeneuve was asking, what do we do for smaller programs that have smaller number of faculty and obviously a smaller number of residents, of course. Each member of the constant committee will obviously be filling other roles in the RPC. So it's almost taking one hat off and putting another hat back on. Obviously, you as program director, you're going to be chairing your RPC, but you're going to have someone else that's going to be running your CC. You may look to, certainly have outside your faculty, outside your program, sit on your comps committee. That would be another option, right? If you have, again, cardiac surgery, or if you have other rotations, potentially you might invite other faculty members from other programs to sit. There was initial discussion when comps committees were discussed about having, members of the public and so forth. And again, I think everyone's sort of moved well away from that, I think, for obvious reasons, but there's no reason why you can't invite other people from other programs. Like, for instance, surgical foundations, is a comps committee made up of all different members from different programs. And so it's easily doable. Yeah. So I guess that's probably the easiest answer for you, James. Right. Yeah.
The other thing I'd say is sometimes we see smaller programs partner up with another program in a similar discipline. So obstetric gynecology has 3 subspecialties. Child and adolescent psychiatry, I think, is partnered up with forensic psychiatry or something. So that's another way of kind of, you're similar enough, but another way to kind of share the workload a bit. And sometimes they just keep it small, 3 or 4 people, and you just manage your 2 or 3 residents, and it's pretty fast.
Yeah, exactly. Okay, we're good so far. So let's get into Elentra. So again, the workflow is in a video on our YouTube channel, so feel free to visit if you want. Also have some handouts that we can send electronically that are literally going to go through that. And also the fillable report that we use has also the cues in it. So anything that people want access to, feel free to ask for it. Happy to share. So let's get into Elentra. Let's hopefully this works. Sometimes Elentra is a little sketchy. Perfect. Okay, so Elantra has come leaps and bounds from where it was. The way to think of Elantra right now, there are two dashboards, the old dashboard and there's the new dashboard. And we'll walk through that. So by clicking the top right, you're into your assessment and evaluation, and then clicking on your My Learners. And there's a lot of stuff in Elantra that I don't even bother with. So I'm taking you through the stuff that I actually look at. So this is a busy graph. This is your old dashboard. I don't even look at this anymore. Okay. Don't even worry about all the color code. It looks pretty and so forth. I don't even look at it. The only thing that I look at in here, in order to sign off your EPAs and click the button green, you've got to do it in the old dashboard. Okay. So I'm going to use a resident who I have received allowance for. She's one of our superstars, so she's okay. So again, you can see there's different tabs here. Logbook functionality is really a non-starter in Elantra, so we don't even use it anymore. We're moving into other things. Again, assessment tab, don't worry about it. So the only thing you want to click on here is your dashboard. And the only reason I look at this or have someone look at it is we have to click on the various EPAs. So each one of these, this is your old dashboard broken down again into your various stages, transition to discipline, foundations, etc. And we can see that Emily, she's in her core year. So these are all signed off. We can see that the green check marks have all been checked off. Once we get down into her core discipline, we can see that some of these are checked off, but some of them are not. And if we want to know more about it, just going to see if I can show you a little bit better. Now, again, Elantra is not perfect. There are some glitches in Elantra. So I'm bringing this out to show you here that when I look at Emily's C4, it looks like 6 assessments have been done, but nothing has been registered here, 0 out of 6. So you can find out a little bit more information by viewing the assessments. So when I open up the individual assessments, quick little hover over it, I can see that again, for this particular EPA, it's a 5-point entrustment scale. And for us in urology, anything that's a 4 out of 5 or a 5 out of 5 is a competent assessment. So she should have this one clicked off, right? Because she is, in fact, has achieved this. So that's part of a little bit of looking at the discrepancies. So as a primary reviewer, I would see this, I would say, and I would make note of that, but I would be clicking this button green and signing that off, okay? That's really the only usefulness to this old dashboard. Okay, I'm gonna go back one here. Actually, I didn't even go back, but so the new dashboard lies in the visual summary. So if you click on your visual summary, we now get into some of these graphs that I spoke of when I reviewed our form. So the first thing that I look at is I look at the normative data. So we've got a list of our different residents in urology, all different training stages. We can filter per stage. So I want to look at my core stage. So these are 3s, 4s, and 5s, basically. And I can see, looking at Emily and the other residents, that she's actually one of our superstars. She's out in front. And just by hovering over it, you can actually see the number of EPAs that she's achieved. And over on the right-hand side, we can actually sort of see I'm not sure you can see that, but basically it's saying the total EPAs, the number of achievements, and the achievement rate as well. So that's one way to look at it. And that's really all that I look at as normative data. Are they an outlier? If there's someone that's really, really low, then that's obviously a flag. They need to be, obviously, there needs to be a discussion with the resident. Okay, so at this stage, I'm now going to take a dive into the resident dashboard. And nothing pops up. because I'm selected a learner. So we're going to select a learner. We get records. And this dashboard was really sort of developed and mimics a dashboard that Dr. Toma from University of Saskatchewan put together. So our original iteration of Elentra was horrible. Then we saw this really brilliant dashboard that he had developed with a master's student over a summer, and we were very jealous of it. And so that's where this dashboard really comes from. So it looks busy, but it's not. So first thing, again, we can look at the rotation schedule. And if you remember what my discussion was, I want to know whether my resident is getting EPAs on their rotations. So you can explode out these, and this is all your 145 data that's migrated in. So we can actually see that in 2023, all of the different rotations, and just by hovering over it gives you a little bit of information as to where they're at. And we can see that greens are good, reds are bad. And your greens basically turn after 5 EPAs. So it's bare minimum. But again, I don't want to see a string of reds across it. So it gives you that 30,000 foot view of your resident, whether they're engaged in the process, whether they're actually getting regular assessments. This is, again, just your total from the normative graph I just showed you. It's the same thing, total EPAs observed, progress rate, achievement rates. And then this is basically over the last 6 months, it's just your weekly EPA assessment rate. So you can sort of see that, well, I mean, November through December, that's going to be a time where people, sometimes residents are on elective, so their outside faculty won't have access to Elentra. Maybe it's holidays, et cetera. But you get, again, this gestalt. The next set of graphs, your recent EPAs, is basically your overall entrustment. So again, you can get a sense of how the last, and these are basically the last 25 records. You can set this over here, 1 month, 3 months, 25 records, et cetera. But you can get an assessment or a feeling of how your resident's doing. So all these are basically entrustment scales too, which basically means, yes, this is at the bottom of your form when you basically say, is the resident competent or not? Yes or no. That's this entrustment scale. And so we're getting a sense that, again, Emily's done extremely well. She's getting all of her EPAs. You can say, well, maybe that's the fact that maybe we're doves and we don't, evaluate her too harshly because she's nice, but the reality is she's very good resident. And again, hovering over it gives you some specifics about that particular EPA, what it was, the type of form, who was the assessor, and then the comments are also there as well. Again, there are other entrustments here, delving into some more of the specifics, but I'm going to just gloss over that for now. We then get into each specific EPA graph, and you sort of think of it as that every EPA will have its own more detailed assessment. So in Emily's case, again, she's completed her transition to discipline, so I don't even have to look at it. She's completed her foundations, I don't even have to look at it. So now I'm down into the core where she's at. And again, anything that's checkmarked green, I don't even have to look at it. I'm flagging this one again to show you that even though on the old dashboard, that's the C4, she by all appearances has achieved that competency. But right now it's saying that she's had 6 observations, but has not actually been checked off. And so there's a little bit of a glitch in the machine. Okay. So just to be aware of that. Because you can actually see that she's received glowing, so 5s, 4s for her last assessments. When we go through this at a deeper dive, so again, we'll go down to another, let's go down to, for instance, let's go here. So C2, performing an initial consultation, developing a plan for investigation or management, patients presenting in the clinic. So we can see again, it's green, so forth. She had a very robust assessment, 4s and 5s. There are some added little bonuses down here. So these different icons. This is your gears icon. that if you wanted to actually get a little bit more contextual understanding which EPAs were for a specific problem, you can do that. I really don't get too deep into this, but it's there. The next one is the book icon. I do look at this. I think, again, I want to see really a variety of assessors. I don't want to see all resident assessors, for instance, because we do have senior residents that act as assessors. I don't want to see the fact that, you know, someone's buddy who's a PGY 5 and they're a PGY 3 and it's all done by their PGY 5 buddy. So I'm seeing that there's a variety of different faculty of assessors, a variety of different situational contexts or contextual variables are different. And I also like to look at the comments. I think that there is a lot of information there in the comments that you get a feel for how the resident's doing. Looking again for any potential outliers and any worrisome comments. Any questions about that so far? All good? Chat's quiet? They're all just amazed. They're all amazed by Elentra. Okay, perfect. So that's the process. And so when I'm doing my primary review, I have my form open that I showed you, and I have Elentra open. And I'm just basically following along with each EPA. I'm looking at that, seeing whether or not they've achieved it, see if there's any progress in that EPA, whether there's any concerns about it with any narrative comments, getting a sense of how the resident is doing. And that's also filled out in the form as I'm going and doing a primary review. At the end of that primary review, again, I should have that form filled out. I should actually have the competency committee report already pre-filled, because I'm the best one to provide, you know, and to guide the discussion at that particular point in time. Okay. So I'll have done all this EPA review in Elentra. I'll have gone into the SharePoint, looking at all the non-EPA data, pulled out all that information that's requested on the form, and filled out the first part of that form. We find that works best, such that when the resident is presented at the competency committee, my job is now competency committee chair. I have all those forms. I bring them up. I guide the process through. And what I mean by that, I ask, you know, James to present his resident to me. He'll actually present the data on that form, make his recommendations, in that final part of the form. We then discuss whether or not there's any need to, you know, have a remediation plan, or whether there's any, you know, further issues for that resident. If they're doing a great job, we basically, again, learners on trajectory, you know, progressing as expected. Upload, we click the box to say upload the form to Elentra, send an email to the resident, date it, and it's done. The post meeting, which we'll get to in a moment here, involves, again, sending out those meetings to the residents if they need to meet with the program director or an academic advisor, site lead, etc. And the program administrator helps to oversee that. My job as CC chair is at the RPC that follows within a couple of weeks, typically, is to present the report. And again, if all the residents are doing great, just say all the residents are doing great. But if there are any specific residents that need to have a little bit of a discussion, that's where we'll delve into a little bit more, a deeper dive into that. Questions?
Are you going to show what the other buttons do?
What other buttons?
Can I show that?
Yeah, for sure. Come on up, Elentra. Show me which buttons.
I just want to make sure that there's another little thing that you can do in here that I think is really helpful. And I do want to echo Jim's comment that I think this is the best view of your way to look at individual EPAs and see if they're achieved. So back to the one that we were looking at. I'm sorry, I just got to move it because the box is in the way. You can also click on this one. Yeah, I don't think you did this one, right? Yeah. So if you click on the little information sign, it actually will collate any other requirements that you needed. So the machine is programmed to tell you, that of the, there's 10 required and that it's been achieved, because we've told it that you want, I don't know, one PSA, one cutaneous genital cancer or something, right? So we've told it that, but if you want to look at that information yourself, you click that information button, and it's all visible to you very quickly. Sorry, I'm not sure why it came up and then it disappeared. But you guys saw it, right? Like,
Yeah.
yeah, it's flicking there for some reason. I don't know why.
Let's go different there. See if this-
So really with, there you go. And then you can scroll it down for any details. And so, you know, here it tells you, for example, it's pretty small, but it tells you that they're still looking for like one priapism presentation. So you can decide, oh, well, you know, performance is really good. We've got a good mix of, you know, she still has 6 months in core. Let's keep this EPA open so we can see if we can get that priapism case that we wanted to see. Or you could decide as a competence committee, you know what, she's got a really good performance, really good mix. We're just going to say the CPA is achieved. I'm not going to chase after that one little detail. You have the flexibility to make those decisions, but this is just a really quick way to see all that data. So, and the other thing I was going to show them is you can screen this data by date as well. So were you
Yeah.
going to show that too?
I didn't want, I
Oh.
don't have that, but go for it.
Oh, okay. So if you go back up to the very top when you go to the resident, you can change the date. So if you want to just look at what happened maybe since your last meeting, so let's say your last competence committee meeting was, you know, November, and then you want to look at, you know, maybe a week before that, just in case there was some, you know, outstanding EPA observations that didn't show up before then, and you want to look until, you know, today, then it'll streamline and it'll only show you EPAs that have had observations since that time. So instead of looking at a great big long dashboard, it can, you know, really highlight for your reviewers the ones that you need to look at. I'm not quite sure why it didn't
These are probably stages that she's already had. That's why.
had. Yeah, I'm not sure why it's not turning it off on you. Did it? Oh, hide EPAs with assessments, with no assessments in this time period. Sorry, that's what I missed, that little button. And now all of a sudden, I'm seeing a much shorter list of EPAs. So it just kind of, again, helps focus your competence committee and your reviewer on maybe a smaller thing. So that's, again, just trying to make it efficient for you. Sorry,
Perfect.
thank-
No, that's a great point.
There was a question in the chat, actually, they're asking for the one that doesn't show, you know, everyone's EPA that says 6 achieved.
Yeah.
Under the reading from the contextual variables, what does it show?
Okay, so we're gonna have to get out of my, out of my little thing.
They,
Just click the blue box for hide EPAs and it'll, they'll get everything again.
So if we go back to C6, I think, right? So we should say,
Yeah.
no, C5, no, or was it C4? Sorry, what was the question?
If you hit over the, if you
Yeah.
hover over the button, do you get more
the
information?
contextual variable highlighting thing, yeah.
So part of this is a glitch, I think, in the system. And this one in particular is, I think there was a change also in the Elantra, right? There was a change in the platform, if I'm not mistaken. And I think that we saw that with changing of some of the forms, we updated forms, some of these were affected. So hopefully on a go forward basis, you won't have that, but I think Emily was still one of the cohorts where there was a change, I think, in some of the forms. Is that correct, Christine? Am I talking correctly? There is, so getting one other point about the contextual variables. Thanks for bringing that up, Yolanda. It was on my list of things to talk about. So it's important to note that when we look, for instance, at C17, it looks like, again, 10 observed, 10 required, but only 9 achieved, 1 to go. Now, it's a little odd to me, but when I look at that, she's had 10 observations. Again, they're just clinical observations. So it's likely that she's achieved that, but why is it still registering only 1 to go? Well, it's the fact that one of the contextual variables is still missing. So it will always continue to show 1 to go. But our job as primary reviewers to say, okay, that EPA management for patients with benign urological conditions and in the office setting. And this is all what our PGY 1s, 2s, and 3s do. They're in the clinics all the time, all the time, all the time. I've worked with Emily. I know about Emily. I've assessed her data. I know that this is basically an EPA that I can sign off on. Okay. So this is where I would go, an instance where I would go into my old dashboard and rectify the situation by turning that and overriding the new dashboard. So that's the only, I think, thing you have to be wary of between the two dashboards. Does that make sense? People in the chat, yeah.
And can I say, and
yeah.
some people delegate that task to the PA after the meeting. So they make their decisions and then kind of say, these are the EPAs that are achieved. And some people choose not to do those clicks until the competence committee results have been shared with the resident.
Yeah.
So that if they're
no,
the ones they were thinking were achieved and they're not questioning it.
It's a great point. I mean, I think again, part of why I'm presenting this workflow is that this was how we worked through and piloted, and I think we were a lot more hands-on because of the control factor. I wanted to get as many people touching these things as possible. So in our workflow, we actually have our program director, Matt Roberts. He's actually scanning through Elentra, and when we say, okay, that EPA is done, he'll be the one that's actually checking the dot green. So we try to tidy that up a little bit. Although we do have excellent program administrators, we feel that, you know, we do it in the moment. So it's sort of a lifting of the. Okay, does that sound okay? So the other thing that I'd like to sort of touch upon in the last 9 minutes is that there are reports that we can look at. So the last little toggle here is your view expired EPAs. So when I look at this, I look at this and say, Emily's very good, but there are EPAs that have been still dated. They've expired. So one of the ways that we can improve upon that is not only to work on the resident development, i.e., you know, fostering that importance of it's okay to come and ask me for an EPA. Right. I want to fill that out for you. And we have very, very specific things that we try to do. I always try to do it in the moment. That's the other thing is the EPA expiration rate is much higher when EPAs are emailed. So doing it in the moment, trying to figure out what works best for the workflow. So in surgery, again, just for James, this is how I do it in surgery. And the fact that we're in the operating room, patient's still under an anesthetic, but we're just standing around waiting for basically the anesthetic gases to wear off. I dismiss the resident. I say, go to the PACU, go do your orders, go do your dictation, open up the EPA, do that self-reflection right now. By the time I hit the PACU, that self-reflection exercise has already been done. I sit down, we do basically a review of that. So it's a knowledge check, making sure that all the points that we discussed in the operating room actually made sense to the resident. Gives me that coaching moment that we all, you know, do anyway, but it's now formalized. And you're able to actually capture those EPAs in a very, very smooth manner. It works seamlessly into your workflow. So that's how we're doing it, how I like to do it. Can't speak for my colleagues. Okay. So with that in mind, the other aspect of ensuring that you have enough data at your CC meeting is the faculty development. So we can generate reports. So again, the other tabs, we were just in the resident dashboard. We go over to the faculty development. Let's get records. So this is our 23-24 data for urology. So again, we can see the global data, total EPAs observed. Again, our mean EPA scores maybe were too soft in urology. Pretty low expiration rate of 14%. You get a sense of how many words are being placed per comment as well. This is your global data. And if I hover over it, I can sort of see who they are, right? I'm going to flag myself, of course, because I don't want to rat anyone else out. You can then delve into it. You can just look and say, I'm going to restrict it just to the faculty. I'm going to put it all departments. So again, if your resident rotates through different departments, they'll capture all that. But I'm going to flag myself here. So it now brings out my specific data, comparatively speaking, to all of the data that's been collected so far for urology. It flags me in terms of observation, expiration rates, entrustment scores, your words per comment, and then some of the comments, right? I then,
It's like, I don't
you don't have this on your dashboard?
know, I end up there.
So again, I think it's program director specific maybe, so, and maybe chair specific. Are you? Okay, should have it.
Mhm.
Anyway, it's a functionality there that we feel, and so what I do is I email this out, I'll take print it, and then you'll capture it, and you can mail it as a PDF to the specific faculty, and if they agree to it, send it to the chair, basically as part of your annual reappointment, right? I mean, this is part of that faculty development. And I've already had some feedback from some of my faculty members saying, you know what, thanks for sending that to me. I didn't realize my expiration rate was over 50%. And wow, I didn't realize how low I was on the curve there, and hopefully I'm going to improve. Okay. There's also programs. So it's a wonderful tool. We're in the Department of Surgery, making that part of our CQI from the department standpoint, you know, sending those out to our faculty members as well as part of an annual process. Elentra has also spearheaded that similar process, I think, for programs. So we have program evaluation. So you can actually look at your data year over year. So again, overall acquisition metrics, but now it's presented year over year. So we can look to see EPAs are the green, EPAs expired. So you can sort of get a sense of how you're doing in terms of your engagement of your faculty and your residents. Again, on a month-to-month basis, you get a sense of how you're doing a year over year. And there's a little bit more data there. There's also the EPA acquisition rates per rotation as well. So, you know, obviously there are going to be some rotations where there's a heavier clinical load, you know, but you may then reflect on, well, why are we getting more EPA assessments in one rotation when I have similar, you know, faculty, for instance, at different sites, right? So maybe there might be site-specific issues to deal with as well. So I think it's helpful. And then for me, the last thing is as a vice chair, I don't know whether this is
This is only you.
this is only me.
Yeah.
Okay. So I have the ability to
PDs don't see
PDs own it. So as a vice chair, I can actually pull out and compare various programs. So I can pull out urology, which is sort of a medium-sized program, to maybe compare it to maybe orthopedics, ballpark, and general surgery. And it will give me those same graphs. And it can be helpful, again, to, you know, to the departments to see, you know, and feed that back to your various programs. So I think it's helpful. I think it's something that, you know, is part of that composite committee CQI, where you can try to ensure that you help your residents. This should not all be on the residents. I think that's the other important aspect I think I'd like to state. We as educators, we really need to be involved, and there's nothing better than when a resident hears you say, listen, I want to do that EPA, let's go, right? Big smile on their face. They want to get that feedback. So I'll stop talking there. And 2 minutes left, 2 minutes left.
Well then.
Any questions either in the room or online? Oh, and I'll just go back here 1 second here, finish out. And again, there are walkthroughs on all the stuff that we presented. During meeting, I talked about Elentra. This is our post meeting. So post meeting, I complete the reports, present the summaries and decisions to the RPC, work on the CQI aspect of things. That same template that we used for our agenda, we use for our minutes. So that's where the program administrator is following along and making the collecting the minutes for the meeting. Helps the program director schedule any post-CC resident meetings, upload those reports into Elentra. Program director, again, obviously has to take care of some of the cleanup afterwards, meetings and so forth. And guides really the RPC in developing any resident learning plans and remediation. We talked about the reports. And last thing I wanted to say, that's our QR code that will take you to our YouTube channel. So we have a lot of walkthroughs there. It's the Office of Education YouTube channel.
There's one question online.
Okay.
Greg Moore is asking, and I'm not sure if I'm understanding this question correctly, but he's asking whether if you, as a supervisor, like get an EPA by email and you fill it out, does the resident get a notification, or should the resident be getting a notification that that EPA has been completed? Greg, if I'm not expressing your question correctly, please try it again. I don't know that residents get notified when something's filled out on them.
It's only 145, so 145, where the items included in your inbox or and they get a email, but they don't get any flags
For EPAs.
so they don't get.
Yeah. So I don't know if you heard that, Greg. So no, in Elentra does not let them know. So they actually need to look into Elentra to see if they've had anything completed. Likewise, they won't know if you haven't done it.
Right.
So they don't, unless they look and chase ones that are expiring, then they don't. And you're right. So unless they're looking, they don't see the written information that you're providing there if it's different. Yeah.
Again, I think hence the reason why, if we can get those EPAs done in the moment, it's really the best opportunity to provide that coaching, you know, and capture the EPA.
Any other questions? Jim, can we share a PDF of your slides?
Everything, yeah,
Okay,
no problem
perfect.
at all.
So we'll do that better. We'll do that, and that way folks can follow directly into the links to some of those great resources.
Yeah, and if there are any questions, feel free to contact myself or Christine Seabrook from the Office of Education. We're happy to share any and all resources that we've developed or have.
Great.
Great. Thanks for the opportunity to chat.
Yeah.
Appreciate it.
Thanks, everybody. So, you know, hoping that you can follow Jim's tips for getting through Elentra, but I really do think those visual summaries are the magic for competence committees in terms of really streamlining and helping your reviewers look at the data quickly.
Great.
All right,
Thank
thanks,
you.
everybody.
Thank you.